So yeah, and guys, those who just joined, thank you for joining. Today we are going to do foam rolling with Jess. So Jess, very experienced physiotherapist. She's gonna bring us through how to do foam rolling. All right. Okay. So if you have your foam roller ready, just prepare. Okay. I have some other question for Jess. Okay, Jess, tell us basically what is foam rolling actually.
Okay, foam rolling, it looks something like this. So basically, it's something where everyone knows about it, but you actually don't know how to use it correctly.
Mm.
Yeah. So I usually use a massage analogy. I will tell my client, so this is a tool for you to massage yourself. So, like, for example, you have muscle stiffness, you go for massage, you will lie down, and then the masseuse will apply some pressure on you, right? But because you do this at home, there is no one to massage for you, so you have to put your body weight on this kind of tool to achieve the massage effect. Yeah, so foam roller is the name of the tool lah. So the action of doing foam roller, doing something on a floor means foam rolling lah. So it's a self massage using a tool.
Mm.
Yes.
All right. So that's basically foam rolling. Some people say call it myofascial.
Okay. Foam rolling means you are using foam roller to massage. Myofascial release is a medical term for massage.
Okay, okay, okay. All right, all right.
Medical,
I only
yes.
know facial or yeah, myofascial is too complicated for me. And what are the type of foam rolling that we have?
Okay, so basically, if you go to the market lah, like Decathlon, Sport Shop, or you go online, you will see the roller at different shape and sizes. The common one is like this, right?
Okay, I got it. That one.
And yeah, similar.
Okay.
And then you see something like this.
Okay.
So this is a smooth surface, right? You have it or not, Azwan?
I think yeah, I have a flat one, just simple.
Yes, yes, and also different shapes like this as well.
Oh, same. Peanut. I call it peanut.
Yes. So a lot of people when I ask them, okay, how you choose the roller, they actually have no idea. I just choose the cheapest one lah.
Mm-hmm. I think I also have a cheapest one from Lazada. The problem
Yes.
with cheapest one, you cannot leave it in car panas-panas. Nanti you come back, it will be lembek. So that's the problem with the cheapest one. So you have to choose yeah. And I think the latest one that I discovered from Decathlon is the vibrating foam roller. So it has like a button, so it will vibrate.
Okay.
So it's
So
getting advanced and advanced, huh?
so besides the price, the shape, you also have to consider the design of the roller. The design is not just cantik only, you know. So if you look at the roller, okay, you notice this roller has the horizontal line, right?
Okay.
Right? And also you have the flat surface, okay? And also you have pointy surface,
Okay.
okay?
Okay.
Yeah. Do you know what's the difference?
Um, they all look
No,
same.
right?
The rocky one,
Okay.
quite painful.
Okay. So basically, this kind of flat roller is suitable for beginner and also suitable for people who have low pain tolerance.
This part.
Yeah.
Okay.
Yes, this part. And if you really have low pain tolerance and beginner, suggest to go for this side, this kind.
Flat. No,
Yeah.
any ring. Okay.
Time, right? So a lot of time when they first try foam roller, it hurts a lot because they use the wrong roller. So they thought this is very uncomfortable because they are using surface. And also, I usually tell them this one feels like people massage you using the palm.
Okay.
So this one, slightly high intensity, it feels like people massage you using the finger. Right?
Oh, okay. All right.
Okay? And then if you look at the pointy surface, it's like fingertip massage. Okay? Fingertip massage is more painful and also deep.
Deep.
Yeah.
Okay.
Depends like if you want a deep massage, you put your body part on this kind of surface, like,
Okay.
or you can get ready a different roller at different shapes. So
Okay.
like as one saw you have the smooth one,
Yeah.
I saw you the pointy one as
Yeah.
well, right?
Yeah.
Like for example, different body parts they have different pain tolerance. Do you think?
Yeah, okay. We will do for the body part later.
Different body part you use different roller. Okay.
Okay. All right. Okay. So that's the type of foam roller that we have. And what is the actual benefit of foam rolling? Why we should do foam rolling?
Okay, so basically foam rolling is to make sure your muscles relax. So I would normally recommend people to do like a day before intensive training and then the night after your intensive training. Because when you have a sore leg, yeah, if your leg is sore after training, if you want to do back-to-back training for a few days consecutively, you won't be able to gain the full effect of your training because your legs are tired. You can't really push much, right? It cannot absorb. So if you want to recover faster, you can do extra set by doing massage, right? So to a massage center, ask people to do it. You can do it yourself. Yeah, it's cheaper. No need to travel.
Yeah, DIY method lah. Yeah.
Yes, yes.
Yeah,
All the massage.
I think that one answered the question when to do the foam rolling. So you said before hard workout or after hard workout. Is it like just before or like I can wait for until I can get home or morning before I get out from the house before the hard workout? What's the optimal time, closest time you would say?
Okay, so when I say before intensive workout, right, it's definitely not immediately before. You have to do a night before. Like for example, tomorrow, Sunday, 6 o'clock, you got to flag off a full marathon. The night before, you have to do it already. You don't wake up 3 o'clock and do it. Yeah. You do already, you're relaxed, the blood circulation is better, you go and sleep. So let the body do a repairing job by themselves. Because when we look at the research paper, right, if you do stretching immediately before the intensive workout or you do foam rolling immediately before, your muscle will get lengthened and then they are not used to the length. And then when you want to perform, right, it's actually put you at high risk of injury. Yeah. So the timing doing it is also important to be safe the night before and 3 to 4 hours after your intensive workout. Otherwise, you a lot of pain when you do it.
Okay.
Because after intense training, the muscles are sore already, right? So if you go and give them pressure, then you won't be able to enjoy the foam rolling session.
Okay, I can really relate to that. So I think that's a really good tips to remember. So a day before your hard workout or race, foam roll, okay? And then 4 or 3 hours later, after your hard workout, after your race, you foam roll, all right? That's a really important point that I think we should remember for runners, all right? Okay, for runners, what are the important body parts that we should focus on?
For runners, important body part, you mean?
Yeah.
Of course, legs lah, huh? So, basically, the glutes muscles means the buttock lah, the calf muscles, the thigh muscles, the groin muscles, yeah, your calf, the groin, and also buttock.
Okay.
Yeah, yes, and then the quadriceps muscles in front.
Yes. Yeah, quads. Okay, that's quads. All right. Okay. All right, got it.
Yeah,
Okay.
and everyone they have different requirement. It's not like everyone must do the whole thing, everything at the same time because we are limited time, right? For example, if you do interval workout, you do sprinting practice, then focus on your calf muscles.
Okay.
Hill workout, climbing hill repeat, work on your glutes muscles.
Okay. So speed workout, calf, climbing, glutes. Okay. Wow, that's really.
Downhill training, right? Work on your quads muscles.
Sorry, what training was that?
Downhill. You run uphill, you walk also, right? And some people they have problem running down here because their knee hurts. Yes. So quads muscles lah. And of course, people with special condition, for example, plantar fasciitis, you have to pay more attention on the calf muscles. And people with some knee pain, pay more attention to your quads muscles. So it depends on the condition.
Oh, okay. So there's a specific parts that you should follow on for specific condition. All right. That's also quite yeah, new for me also. All right. So so now it's time to put everything into practical. Okay. So we're gonna start foam rolling. So which part we should start foam roll first? Yes.
We start from top to the bottom lah. Let's start from the buttock first.
Okay. All right. I'm gonna put my
Before I go to the practical part, I need to give you some tips on how I normally do it lah.
okay.
So yeah, there's actually three steps. Okay, first you must identify where you want to roll. For
Where?
example, if yeah, so you must actually scan the whole area, look for the tender points.
Oh, okay. So for me, like yeah. So for my calf, so I just try to find with rolling, right? Where I was rolling.
Yes.
Okay. Okay.
For
Okay.
you go first, Okay, you.
Okay. I'm gonna use this one. All right. So try to find the tender spot. So maybe you can see the tender spot when my face is like that. Okay. Right. So trying to find the tender spot. Okay. I'm gonna put pressure. Yeah. I think. Yeah.
Okay.
Okay.
So,
Okay.
so that spot, you have to scan the whole calf. I have a client, he told me, I actually foam roll my calf, so I asked him, so where did you foam roll, show me. So what he did was, what he did was this.
Oh.
Yeah, the upper calf. So he forgot to scan the upper part. That's why foam roll is not effective for him because you only work on the lower part. So the scanning calf muscle comes from the ankle, goes all the way here. So when you scan, right, you have to scan from the ankle to actually the whole thing back of the leg. Okay? Then you will not miss any tender spot.
Okay. So from the ankle to the calf. All right.
Yeah, to the back of the knee.
Back of the knee. Okay.
Yes. Yeah. Because that's where the calf is.
Okay.
So, tender spot already.
Okay. Found the tender spot.
Yeah.
You got it.
Already. Okay. So what you normally do? Can you show me, Azwan? When you found a spot.
So if I found a spot, I just roll over it. Just go back and forth. Is it correct?
Okay. I'll give you a more easy and effective, less tiring method. Okay? So once you found the spot, right? Usually the spot is not big, they are small. So you don't have to roll at big movement.
Okay.
So about 1 inch is good enough.
Oh.
1
Okay.
inch. Yeah?
1 inch, alright.
Otherwise, this is very tiring for the shoulder and the wrist.
Yeah. So I just focus on that 1 inch.
Yeah, about 1 inch there. Okay, once you are done, for those people where their upper body is not strong, right? You don't have to lift the whole body. You just stay there and
Oh, you can just stay there.
side to side.
Okay, side to side.
Your shoulder also lazy version.
Okay. So yeah.
For people with a wrist problem, painful shoulder, better method. Okay? So their arms are.
Okay.
So once you're done with the spot, move on to the other one.
Okay, so we tackle one by one. The painful spot.
Yes. Yes.
Okay. Right.
If you go massage, imagine the massage you very fast, also not comfortable, right? So if they massage, the knee also is better.
Okay, slow and steady. All right. Okay.
One by one.
One by
1 inch only.
Okay, 1 inch only. Okay, guys, let's do it together. Just that, focus on that tender spot. Okay, 1 inch only. Yeah, just like that. Yeah.
Yeah, and normally, how much time you spend rolling on your calf, Azwan?
Maybe less than a minute or two. Yeah.
Okay, each spot maximum 1 minute.
Oh, maximum 1 minute. Okay.
Like for example, your calf has 3 spots. So
Okay.
you spend 3 minutes. Yeah, you
Okay.
don't do too long because it cross bruises the
Oh,
palm, cause
okay.
a lot of things. Mm.
So each spot try to spend how long? Come again?
1 minute.
Okay, 1 minute for
One
each group muscle.
minute for
Okay.
one spot. That's why,
One
like
spot.
if
Okay.
your leg, yeah, if your leg have 3 spots, then 3 minutes.
Okay, okay, alright, got it,
And
got it. So, okay.
different.
So after calf, we will move to buttock.
Okay, move to buttock. So basically 3 steps: scan, and then
Okay.
find the spot. Okay, and then roll the tender spot.
Okay.
Repeat for any body part.
Alright. Scan, find, focus on that tender spot. Okay.
Yes.
Alright. So I'm gonna scan. So the right way for buttock is
You show me how.
if I want to focus here, I have to do here, right?
Yes.
Okay. Right. Oh. Eh. Oh. Right. So I'm gonna found. Yeah, I think I found one. Right. I'm gonna. Okay, that's a really. Yeah.
Okay.
Yeah. Yeah.
Okay. Instead of putting your hand at the back,
Okay.
if you want more stimulation, right? Put the other hand on your right hand side as well.
Okay. Like this.
Yeah.
Oh. Okay. Okay. That's. Yeah.
It will actually help the side glute muscles.
Yeah. I can feel it sideways.
Yep. Some people they have pain slightly at the side of the buttock. So
Yeah.
if you use this macam style
That cannot. Cannot reach to that sideway. Now I can
so
reach.
some people they have a lot of pain when they do this, then you do with your hands at the back modified.
Okay.
Or if very painful, then do like this sitting on it. Sit on the roller.
Oh, sitting also can.
Boleh?
Okay.
But no pain tolerance.
But yeah lah, no pain for me. So I'm gonna go with that bend. Yeah, like that.
Your butt is butt of steel good. Maybe in this case you have to change the roller already.
Okay.
You the pointy one.
I can feel it. So I just stick to this plain roller. Yeah. Okay, that's about the back. Okay, yeah, I got it. Okay, so the next spot where we're gonna focus.
The thigh muscles.
Thigh muscles. All right. So it's gonna be that, right? Yeah. Is there any other like different technique that we can use other than this?
Your left hand side.
Okay.
Left leg, so I can see your right leg position.
Okay. Okay. That.
Okay. Yeah. You get into the position. See.
Like that. Oh, is there a different way?
Okay.
She give up already.
No, like. You
Okay.
can see me roller, right? Okay. If you want to roll your left leg, so first must scan, right? So
Yeah.
you must scan this part all the way down to the top of the knee.
Okay. Okay. Scan, Alright. From the. Okay.
Yeah. So you put the roller.
Mm-hmm.
So your right put in an L shape.
Okay.
So you use the leg to actually move you forward and backward.
Oh.
Use your leg to move. It's easier.
Yeah.
Yeah. So you scan. My turn. Okay,
Yeah,
if you are in a lot of pain, right? You try to not lean on the elbow, lean on your hand.
Okay. Okay. Yeah, I can feel the spot.
Yeah, so by changing the arm placement from here to here, it helps to change the pressure of
Okay.
Yeah,
Here
so
the pressure is more.
Yes.
Here is less.
Yes. So if your body is closer to the floor, means higher intensity.
Okay. Got it. So if you don't feel pain this way, so you should just go with your elbow, guys. Just like planking.
I have other method for people who with weak shoulder, right? They cannot
Okay.
keep rolling. Okay,
Okay.
can you get into position again? That one?
This position. Okay.
And then I need you to bend your left knee.
Bend. It's already bent.
This is your right leg now. Left leg.
Yes. Yeah.
Oh yeah.
Yeah, okay. Okay, probably demo.
Okay. The one that you want to roll,
Okay.
instead of doing that, you do this.
Oh, okay. All right. Okay. Okay. Instead of rolling, so I just okay. So
Yes.
you just find that sweet spot, and then you just stay there and bend.
Yes.
Okay. Alright,
It
got
gives
it.
objective lah. Just different way of doing it only.
Okay. Alright. Okay, got it. And so that's quads. Anything else about the rolling for the quads?
Our quads is we have inner quads also, right? Inner quads.
Yeah.
Yeah.
Okay. Alright.
Yeah.
So, right. Okay.
Some people they will have some problem here, inner and lower part of the knees. Yeah. Okay. Do you normally roll this area, Evan?
I don't know how to reach there.
Don't know, right? Okay.
Yeah.
Same position as the quads. Just how quads like one leg straight, one leg bent, right?
Okay.
So now you put the roller on the bent leg.
Okay. Okay. Side way. Like this.
Yes.
Oh. Okay.
Yes.
Okay. So. Okay. Like this.
Yes. Now this is how you scan, right? Can you scan to the knee as well a bit more?
Okay. I think I have to. Yeah. Put this. Should put it sideways. Yeah. Here. Maybe here. Oh, the floor is hard. Okay. So. Okay. Until the knee. Until the knee, yeah.
Yeah, until the knee. Do you found the tender spot there?
Yeah. It's right.
Stop
Right
it there.
Yeah.
Yes. Okay, stop it there. Lie on your elbow and then bend and straighten the knee again. Yes. Found it, right?
Yeah, found it.
Yeah.
So magical.
So you suddenly feel like you discover some new pain lah.
You know, it's really hard to like when I press, I know there's some soreness, but it's really hard to reach there. So this tips is really good. I could reach towards there and then just
A lot of people they actually miss out this area.
Yeah. I'm gonna do the other side as well, just to keep it balanced. Yeah. This side pretty okay compared to left.
Right leg good, right leg dominant.
Yeah.
Dominant leg will be.
Yeah. Okay. Really good. Okay. So is there anything else about the inner thigh?
Not at the moment.
Okay.
Yeah.
Okay. So we have done for calf. We have done for buttock. Quads. And then we have done for inner thigh.
Yeah. Basically these are
If you guys have any parts that you want just to demo that we haven't covered, you can let us know. But we're gonna cover only one part. All right. So just let's go through the comments and see.
I feel rolling biceps. Okay. For runners, bicep usually very seldom lah, unless you a gym goer. Yeah. So for bicep, I will use this kind of this bicep.
Peanut.
So basically, it's like that.
Okay. Bicep, I think easy lah. You just like that only. Yeah. You don't need foam roller. Because foam roller, you're using foam roller because you have these large muscles that you want to focus, so you use foam roller to get that. But like for the muscle also, like if you want to really go deep, you can use like hard balls, right?
Okay. I saw people asking about plantar fascia.
Okay, plantar, alright. Okay.
Okay, plantar fascia.
Go back.
Okay, is the bottom of the foot lah, huh? So you
Uh-huh.
have to use the ball.
Okay.
Adwan, how you foam roll plantar fascia normally? Yeah.
I try to sit usually, so I just you can see. Okay, for further. Okay, just like that, like that. Yeah, try to focus on the arch. Yeah.
Try to bring your body weight forwards.
Okay, body weight forward. So.
With the, like for example, if you are rolling your left leg, right?
Okay.
So lean your left leg in front.
Okay, like this.
Then body weight on it.
Okay, alright. So the legs that roll has to be behind.
In front, not behind. In front.
In front, okay.
Okay,
Okay.
so and body lean forward.
Okay, so it's like this.
Yeah.
Alright, lean slightly, just like running. So you feel all the weights on your leg. Yeah.
Besides one, you can move your toes up and down, up and down.
Okay.
Yes. So people with plantar fasciitis, usually the pain will be slightly close to the heel area.
Yeah. Like the arch.
You stop the ball at the heel area and then you do the toes wiggling.
Okay. Okay, like that. Okay, so that's okay.
So I saw Constant ask about shin splints, right? So for shin splint focus on rolling on the calf muscles.
Okay.
Yeah.
Remember, guys, those who are with shin splint roll on calf muscle. Yeah.
But of course, shin splint you have to a lot of times shin splints is caused by the incorrect training and also not so good running form. So we have to look into all this also but today our topic is more on foam rolling, right? So in terms of foam rolling for shin splint, focus on the calf.
Yeah.
Okay.
I think if you go to Jess Physio Center, that's a different flyer. Okay. If you go to Jess Physio Center, she has this flyer that focus on shin splint. I got it, but I think it's in the other office bag, so I cannot show to you. Yeah. So yeah, we can talk about that maybe someday. Yeah. Okay. How about lower back? Is it this? My friend has been asking lower back. Is it can we massage on lower back?
Yeah. Okay. For lower back, where is my roller? Okay, I don't recommend use this one because if you sleep on this thing, right, you actually, for people with quite bony, you actually hit the spine and it cause some pain.
That's how safe.
Yeah, so that's when we use the peanut ball. So because our lower back pain usually tight, right? So the hole in the cleavage in between the ball, it actually help to avoid pressure on the spine.
Okay.
So like this is the ball. So don't roll on the ball, roll the side. Yeah. On the floor.
That's new. I always use this for the feet only. Today I know I can use it for other stuff. Other part.
You can do this.
Oh.
So core is not strong. You can play and then you.
Oh. Okay, that's a bit extreme. Okay, maybe not for me.
Okay. Because you are very bony, let me demonstrate on the wall.
Okay, we can do it on the wall. Okay.
Roller.
Okay.
A little bit of half squat.
Cool. This is better. Much more control, the pressure. Easy to control.
Or alternatively, you can use the massage ball, Azwan.
Ah.
Try massage ball. Eh, yes.
Yeah, but
Yeah. Do you feel it?
yeah, I also can feel it, but it's like imbalance a bit compared to peanut.
So use of massage ball is more like for people with pain on one side. For
Ah,
example,
okay.
people, oh, I pain on my right side only,
Mhm.
then you can use massage ball lah.
Someone asked about the peanut cat, like what we use. I use it for feet also, like for my plantar. Yeah, like here, like it can just like that. You can see okay, cannot see. Yeah, right here, and also for the calf because I like it because it goes like to the okay, fell down. Okay, so it goes sideways like. I'm really bad at this coordinating, like that. So that's the other part that I use this peanut for usually. All right, thank you for the question, guys.
Yeah, peanut for calf, peanut for lower back. Yeah, these are the two main area or small muscles like shoulder.
Okay, let's see what are the question. IT band. What's your opinion, Jess, about IT band? It's a very controversial question.
Yes. Yeah. So like just now like we mentioned, right? Foam rolling is for myofascia, but basically IT band is not. There are still people debating whether they are muscles or not.
Mm-hmm.
So the foam roller on IT band is controversial, but just to show you how to do it, I still can show you.
Okay.
IT band, okay? It is from here all the way down here, but usually the pain will be at the lower part. But for scanning purposes, must scan the whole thing. Right?
Okay.
Can you get into the position as one?
Yeah, I'm going to use the very plain one because because IT band you have to be go soft. Yeah, so I'll just put it that. Oh.
Get the thing.
Yeah, I can feel it.
Okay. So besides
Yeah.
this, okay. Still, you can put one leg in front.
Okay.
Use your leg to move you.
Yeah.
Easier?
Good. Easy.
Easier.
Yeah. So it just really good because I think IT band has been like a very tight part of the body. Yeah. Okay.
Yes.
So yeah, we are done with the rolling. Let's just address some question like effective way of calf muscle. Like is there any effective way of? I think what just said earlier is already quite effective and very deep already. Yeah. Is there any other way?
A lot of time where the effectiveness of foam roller is not it because of the wrong technique.
Mm-hmm.
So the correct technique, it will be effective.
Okay. All right. Thank you for that.
Small roller.
What's that? What's the question?
Small foam roller. Which small roller you're talking about? Constant.
Constant. How to form roll? Fascia. Fascia already.
Sciatica. Oh, sciatica. Ayo, very, very deep question lah.
Okay.
Some people say sciatica pain. Okay, so constant and sciatica. And so for those who don't know what sciatica means, sciatica people with pain from the buttock down to the back of the thigh.
It's like you don't know where to find the cause. It's like
so for
mysterious buttock pain when you run. It tingles like an electric shock. Yeah.
Yeah. So sciatica, you have to be careful because it can be, some people with sciatica can be because of slip disc. So sometimes sciatica, you can roll your buttock, but not every time. So you must get the physio to assess and see whether it's suitable to use rolling to help with.
Okay, so that's
people got sciatica pain when they roll their back. That means it's not suitable, wrong technique, and maybe they have to use other alternative way because you're not supposed to have sciatica sensation when you do rolling. Okay?
So that's really we need diagnosis and consultation for that. So maybe said that's something we cannot just answer online. Yeah. Okay. All right. So does foam rolling makes muscle weaker? Is it a myth? Is it, yeah? Can you address that?
Okay. Let me drink water first.
Okay. Sure. Okay, those who just joined, I'm with Jess from Apple Physio. She's very experienced physio. She is very related. She has been treating a lot of runners, so I think Jess is fantastic in that way. She understands what runners need. She understands how stubborn runners are. So Jess has been guiding us all this basic stuff, and now we are going into Q&A session. So if you have question, post it, okay, blast it down there. We try to answer on that. Okay, we don't have much time left. I think both of us are hungry. So let's take a few questions. All right. So for the question that I asked just now, will foam rolling make our muscle weaker?
Okay, no, actually it's not true. So we use foam roller when we feel our muscles are tight. So in some cases, the physio will ask you not to use to treat tightness. That is because tightness can actually caused by weakness. That's why its assessment is very important. So when patients come to my office, right, I have to do some assessment first, strength test. So if I notice they have a lot of weakness issue, I will always ask them to strengthen first, and then only I talk about foam rolling. So there's reason why your physio asks you not to foam roll, but instead strengthening first. So lack of strength can cause tightness around the joint. So
I think.
understand why the tightness come at the first place. Yeah.
So just like like you're going from your house to KL or somewhere, there's many different paths, right? Just like so physiotherapy also that way. They have different school approach. They have different thoughts. So I think you have to like try and see which one really works for you. Which physiotherapist you have confidence with. If you think that this method works for you, then just stick to it. If you think this method works for you, then stick to it. All right. Okay. ITB tu.
ITB is called incorrect running form or weak muscle. Okay, so let's talk about what actually cause someone is suffering from injury. So there are actually three main reasons. So reason number one is your body weight. First, look at your body weight first. Is your body weight ideal with in relation to your height, BMI? So if you're overweight, please look at your weight as well. So secondly is a history of injury. For example, if you injured your leg before, so the chances of you getting injured will be higher. So besides treating the existing injury, reflect and then see whether maybe previously you injured your leg but you did not treat them. And the last one, the one is the training error. And 60% of people have this mistake. For example, too much, running too much, too soon at one time. Yeah. So first must reflect these three first. So no matter what kind of running injury, these three must reflect. And then when you come to a physio center, the physio should do assessment first because ITB can be muscle weakness of inner part of your knee, yeah, or some other parts of your knee. It cause compensation. And also, it could be because of running form. We don't know which one. That's why we must do assessment first. Yeah.
Yeah, I think it's it can be multiple. It can be from basic. It can be your shoe. It can be a surface. Many factors. So I think the best is you have to come, sit down, talk, and assess on the issue. And sometimes it's an experiment. You have to like fix this one and see which is it work. Fix this one and see does it work. So it's a bit tricky as well. So it's really hard to answer, give that one exact answer on that question. All right. I think we can go to the another one important question. Which part of the body that you have to avoid foam rolling? Which part is we have to? It's not safe to foam roll.
Okay, chest area. Chest area. Don't roll your chest
Okay,
because
chest.
our ribs are very superficial and fragile.
Okay.
And when foam rolling, we use our body weight on it. So rolling on the ribs can actually put you at risk of cracking the ribs. So avoid it.
Okay.
And also avoid rolling directly or putting any roller directly on the spine.
Spine.
Spine, yeah? Yeah, the middle part of your back, basically. So
Mm-hmm.
these are area. And also, please do not foam roll on a place where you see open wound.
Okay. Open
Okay.
wound. All right. Definitely no.
If you twisted your ankle, no open wound, but you see blue black swelling, please don't roll on them.
Okay.
Yeah.
Okay.
Which body part, yeah. So don't roll on them. Like for example, if you have some people have bike crash, they fell from the bike.
Mm-hmm.
Before they see doctor, they feel sore on the area of pain. Don't roll it because you might have actually cracked the bone.
Mm.
Then if
Mm.
you roll it will make the crack worse. So
Mm-hmm.
unless you've seen doctor, X-ray taken, nothing is broken
Mm-hmm.
and no bruises, then you can use it.
Mm-hmm.
Yeah.
Okay. And also joints, right? Like
Yeah.
hip joints. Yeah.
To because there's no muscles on the joint line
Uh-huh.
area. Like for example, joint the knee, right? There's no muscles here.
Yeah. Yeah.
But if you improve your knee problem, you roll here around the joint instead of
Uh-huh.
directly on the yeah.
Okay. All right. Okay. I think same goes to like rehab exercise for the knee. You usually strengthen the muscle around the knee instead of the knee itself,
Yes.
right? Because knee doesn't have
Yes.
any muscles, right? Yeah. Okay.
Yeah.
I think let's see one last question. Normal to have a minor bruise after foam roll? That's the
No,
last.
no. So
Oh
if
no.
you're bruised up low, it's either the technique is wrong. Maybe you roll too long, lady.
Okay, okay, okay.
I
Alright,
get some client tell me, oh, well, I injured because I do foam rolling, I bruises because they roll like 30 minutes.
oh,
Well,
okay. Yeah, that's not the I think the best way. Okay, some of you ask what is it?
no, I say one minute
Okay.
rolling 1 minute.
1 minute.
Otherwise,
Okay, 1 minute is the rule of thumb that we should remember. Okay, some of you asked about question on the addressing injury, groin injury. I think that would be pretty long topic, and the answer will be pretty same. Maybe perhaps next time we can try on that. I think we are quite fruitful session. We are quite packed. I hope today's session will be very useful for you. So if you have any question, just shoot to Apple Physio. All right, you follow their Instagram, Apple_physiotherapy. You can also like their page in Facebook. They are based in Petaling Jaya, Ampang, and where else?
these two main branch actually.
These two main branch, so you can focus on that. I usually go to PJ branch because they have swimming pool, they have ANW, and also they have Kanda, so you can.
Now
Yeah.
I know why. Not because of me, because of NW.
Yeah.
Okay.
So Jazz is based on PJ branch, so you can approach Jazz in PJ as well. All right. So I hope today's information is very, very fruitful. Thank you so much, Jazz, for your time. I think during lockdown period, we have been doing this is very useful for the runners. All right. Thank you very much, Jazz, to keep them entertained, to keep them informative. I hope next time we can do it together physically in your center. Yeah, let's hope for that, and let's hope everything is. Let's flatten the curve. Anything else?
Okay.
Yes, you want to say?
I saw people asking about bow leg.
Okay.
Yeah. So I can help with minor bow leg correction. So, but I'm not sure how severe is the bow leg. So you can take a picture of your leg and show me. Then I can advise you better.
All right. Okay. Thank you. Thank you for the question, guys. Thank you for the need. Okay, we gonna sign off. Tomorrow I will join Irene Chong 9 a.m. for a strength session with her, and maybe tomorrow night we'll do something exercise. All right. I hope Jess can join together as well. All right, just to keep ourselves fit. Okay. Thank you guys for tuning in. Thank you, Jess. All right. See you guys. Bye.
Bye.
Thank you.